Hello, hi everyone. Eldrigu Namaskara. I've been asked by the management of Flowers of Paradise School Malpe to talk about Corona pandemic. Well, most of you know many things about Corona already, because this is one disease which has actually affected the population worldwide, and there's so much of research around it, but still we do not know many things. Actually, we all know that there are different waves of the how the corona virus spreads and how it affects population. And there's going to be a third wave very soon, and all of us are worried because we do not know exactly how it behaves. But not that we do not know anything, because it has affected different countries and it has come in waves, it has affected certain percentage of population, it has come down, and vaccines are actually are in use already, and a significant proportion of population are vaccinated in some parts of the world. And yes, we know something. So based on whatever research that has happened and whatever is published already, and with some experience in handling COVID as part of a helpline called Karnataka Covid Volunteers Team, I would like to present few things before you. Well, let us go slide by slide in this PowerPoint, and we'll understand the nature of any pandemic for that matter. Well, all of us know that there are different types of diseases. Some are communicable diseases, some are non-communicable diseases. Generally, when we say that there is an epidemic, there is a pandemic, that means a virus is involved. And there are different types of microorganisms which we can see only through a microscope. And in this slide, you can see the size, the relative size of different microorganisms. And well, it is not just a virus, but virus, bacteria, fungi, protozoa, algae, all these cause diseases in human beings. And we are familiar with the common cold, which is also caused by virus, mumps, chickenpox, smallpox, pox. Most of you must have not known, because it is our generation which took the last set of vaccine for smallpox, and smallpox is almost, I mean, it is eradicated from the world. And rabies is also caused by virus. And because of the movement of the people world over, which is far much higher than that we saw in the previous centuries, now the viruses or bacteria, fungi, they're not limited to one or the other country. You must actually know what is the difference between epidemic, pandemic, and endemic. Endemic is something that belongs to a particular region of a country or a particular set of people in a country. For example, I can tell you that malaria, that to falciparum malaria, is more seen in Tumkur and Hassan districts of Karnataka. And KFD, Kashmir forest disease, is mostly seen in some part of Shimoga district. So, in cases like that, the disease spread is not so much that it passes the borders of state, country. As I told you, few diseases are restricted to particular districts. And epidemic is a disease that affects a large number of people within a community, a population, a region. So endemic is something which does not generally cross a particular border. Border is not actually the border that we have created politically, but the borders that are created by nature. So, but pandemic is something which is actually, which spreads across continents. So it spread over multiple countries and continents. And COVID, Corona, is actually one such pandemic. See, what is the difference between this Corona and COVID? See, COVID is nothing but coronavirus infectious disease. That is the COVID. And since it started in the later part of 2019, it is called COVID-19. And this coronavirus is not new. Coronavirus was also there. In fact, this coronavirus only caused SARS disease, and there's something called MERS, Middle East Respiratory Syndrome, and there were coronaviruses even before. But what we saw towards the end of 2019 in Wuhan area of the present China was something different that it spread too fast. See, there are two, three things that we need to know about the quality of virus. What does it do? So, one, how severe the disease will be, and two, how fast it spreads. So here there are important and interesting things that we need to know. Some viruses which are actually life-threatening, which are very deadly viruses, those viruses actually they do not spread fast. But COVID, the coronavirus or SARS-CoV-2, this particular virus, not that it causes death in every patient that it affects. No. In fact, the mortality is as less as 1 to 2%. And in fact, in about 70 to 80% of the people who are affected by the coronavirus, who are infected by coronavirus, there is no symptom at all. They're called asymptomatic patients of corona. But in about 10 to 20% or even a little more, people they show symptoms mild to severe. So those who have mild virus, mild infection, or say mild viral disease, they recover without any medication or without any medical care. But a small part of it, maybe say 5% of them, they need hospitalization, and some of them they need oxygen, and some more of them they actually need ICU care. So only a small part of the population which is infected by coronavirus, they in fact die. Very, very small part. Well, it varies from 0.5% to 1%, 2%, 3%, depending on the type of virus, that is, which variant is affected, and the medical care that they get in that particular country or state. So now the issue is, if it is so less, if the mortality is so less, why are we worried so much? It is because in a very short span of time, coronavirus affects a large population. And even if 2%, 3%, or 4 to 5% of people, they require hospitalization, there is no country in the world which has so much resources that it can admit 1% of its population at a single time simultaneously. So that is the problem with virus. So as all of you know, in the later part of 2019, coronavirus was detected in Wuhan, China, and later Italy was affected, North Italy was affected more, and Iran was affected, and then it spread to a whole lot of countries. And in the early part of 2020, India was also affected. So the initial cases were seen in Kerala, and then no part of India is actually now, there's no part which is not affected. Okay. So now let us get into the infection part of it. So we need to know how the coronavirus get into the respiratory system. So there is a video that will play in the background, but meanwhile I'll explain you how coronavirus affects our respiratory system. Well, as I told you, there are different microorganisms which affect us differently, but particularly the coronavirus, it affects our respiratory system most. All of you know that tuberculosis affects whole body, but it affects lungs more. And typhoid affects our intestines, but coronavirus affects our respiratory system. So the coronavirus, when it is thrown out by a patient who is already affected, will contract the virus through the aerosols and the droplets that the other person who is already affected uh, puts it out through sneezing or coughing. And even if we touch the droplet that is secreted out, that is pushed out of, that is sneezed out of the patient, and we touch the same finger we touch our nose, our face with the same finger, then there's a chance that this um, coronavirus gets into our nose and then down into the lungs. Of course, it does not get into the lungs in the first day, but it slowly spreads from our nose, then throat to lungs. That is why generally people say that after 7 days, that the patient may have serious respiratory symptoms or respiratory distress. Till then, the patient will have mild symptoms like fever, common cold, throat pain, body ache, and all that. So once it gets into the respiratory path, then as it is shown in this video, it gets into the body through that spike protein that you can see. And there's a receptor, it's called ACA receptor, and the virus gets into the cell and it replicates too fast. So once it gets into the cells in the respiratory system, it is not just that the virus itself affects the body, but the reaction of the body to the virus also uh, actually does a big damage to our respiratory system. So the respiratory system is responsible for providing us the oxygen. So if there is more and more infection, or if there is more and more reaction of the body to the infection, then because of this pneumonia, patient will have insufficiency of oxygen. So the oxygen saturation, that is somewhere between 93 to 99 or 100 in any person, will start dropping down. So it is at this time that the patient needs hospitalization and oxygen, and to contain the inflammation, that is the body's reaction to the virus, will have to be given steroids and other medication. So, but we'll have a doubt in our mind that why don't the doctors can kill this virus much before it gets into the virus? Well, um, it's generally we have this feeling in our mind that we'll have either some medicine or injection that can kill the virus. Well, this particular opinion has come to our mind because we know antibiotics that will kill bacteria, even if it is a dangerous bacteria like tuberculosis. Tuberculosis bacteria is no more dangerous because we have many medicines that can kill the ordinary TB, tuberculosis bacilli, or even if it is drug resistant, then there are many drugs, newer drugs that can kill these bacteria. But generally, antiviral drug, as such, there's not much antiviral drugs. But even when we have some antiviral drugs, like the famous remdesivir that you've heard now, it cannot kill the virus totally. It cannot eliminate the virus. Instead, some of the antiviral medications, they are known to lessen the viral load in the body. So that is the reason why we're all scared about coronavirus when it becomes serious. But before that, the body has an innate capacity to manage such infections. So body will definitely respond by producing antibodies, and with whatever white blood cells that are there in the blood, they will try to kill and
eliminate the infection that is there in our body. But sometimes it so happens that the body cannot actually overcome the infection on itself, or rather, there is one more issue with that the body will respond more. This overreaction can also cause damage to us. So this overreaction results in increased inflammation, increased CRP levels in our body, and sometimes some infections like this can cause clotting of the blood, clotting of the blood in lungs and even in other places. That is why the coagulability of the blood is tested through D-dimer test in most of the patients, COVID patients who have had moderate to severe degree of illness, and also the CRP test, which is actually a marker of the inflammation. So yes, during some part of the infection, doctors do try some antiviral drugs, but there is not much evidence to suggest that these antiviral medication can really help the patient in a big way. But there are some studies, some clinical trials, though not accepted by all, that at some part of the infective period, maybe say fifth to seventh day, that remdesivir is useful. But well, there are differences about that opinion also. Without actually having a sufficient evidence, some medications were tried in the beginning. That was hydroxychloroquine in the beginning, and zinc and vitamin C was given since it helps in building general immunity. And ivermectin, an anti-helminthic drug, was tried sometime. So there are many such medications were tried, and media also hyped it up like anything. And people were in panic if they do not get those injections or medicines. So of late, finally, both WHO and ICMR dropped many of such medications from its so-called kit. So earlier, but these were all tried not just in India, but in different countries also. So these, when medicines are not so effective, but at the same time, infections keep spreading, it spreads in waves. See, whenever there is a highly spreading infection like this, then depending upon what is the critical number of vulnerable population around already infected people, a wave starts. A wave starts, and when people start taking precautions, then slowly the number of vulnerable population, the vulnerable people around the infected people, it comes down and the wave drops. But after some time, then again, since people do not take precautions and it is not possible to avoid all the activity, whether it is economic or social activity that people, human beings, are bound to do, then naturally the spread again starts. The spread again starts, and when it reaches a critical, a critical number of people are there who are vulnerable, then again a second wave starts. So that is how the corona pandemic is spreading. And you can see in this slide that the US second wave, US third wave, and Indian wave, how it spread. So we are in the towards the end of second wave in India, and fortunately, by the time the second wave is settling down, or even actually when second wave started, we had this vaccine. So what is a vaccine? Vaccine is actually inducing an infection by the same virus, but inducing the immune reaction in the body without causing an infection. So you know that there is a vaccine for rabies, vaccine for polio, vaccine for smallpox, and many such viruses, vaccines. So in a vaccine, either a neutralized virus or a part of the virus is given as an injection. So when it is given to any person orally or through injections, that person will develop immunity and will provide some uh, protection from the future infections. But it is not just with the vaccine, but the infection itself gives you a protection. And in fact, a single dose of vaccine cannot give so much of protection as a natural infection does. Because when you have natural infection, you are exposed to the whole virus itself, the living virus itself. But when you are actually exposed to vaccine, you are only exposed only to part of the virus. So though that was there, that vaccine was there in India, there were some questions about the vaccine because these are not the vaccines that were actually produced in an ideal condition. In an ideal condition, generally, the vaccine passes through many tests. And those tests, in fact, they identify what are the immediate complications, what are the short-term complications, what are the long-term complications, all that. Probably some of you must have read in newspapers that these vaccines are approved for emergency use because these corona cases, when they increase so much in any population, it is very difficult to manage, and we cannot wait for long to get a properly tested vaccine. So, as I told you, all infections do not lead to hospitalization, and all hospitalization does not lead to death of the patient. But since the corona infection and subsequent pneumonia, it causes the drop in oxygen level. The patient needs to be admitted and sometimes into ICU. So a government, if it knows that such a epidemic or a pandemic is affecting our population, it has to make preparation to increase the number of oxygen beds, number of ICU beds, number of COVID care centers, all that. But when it affected us for the first time, even then there were lacuna in preparation because already China was affected, Italy was affected, Iran was affected, and we knew some of the behavioral pattern of COVID virus. But well, we could not stop the flights from different countries, and initially there was no proper restriction on the movement of the people who were traveling from these infected countries. But when it was actually clear that India has seen such cases in Kerala and other places, then government started putting restrictions, and thorough lockdown was imposed in the third or fourth week of March 2020. So such lockdowns, in fact, they serve two purposes. One, it restricts the movement, but at the same time, government has to make preparations, war-footing preparations, uh, to manage the future patients, because lockdown cannot be put in place for weeks, months, and years. That cannot happen because that will restrict the social and economic life of the people, and the entire country will get into economic distress. And the period should be used to upgrade our oxygen supply, bed availability, or ICU care. Unfortunately, it was not done so much, particularly for second waves of preparation was not done. And as you know, because of lack of oxygen, people died in Chamarajanagar District Hospital. And it is not the case of Chamarajanagar District Hospital alone, but in many big cities, people were actually running for oxygen beds. And since already they were occupied, and once a patient get into the hospital, they'll stay there for some time, and in ICU they stay for longer time, and there were shortage of ICU beds for almost a month in places like Bangalore. So you will have to infuse more funds and plan early and manage oxygen distribution and all these things in advance, which was not done to the required um, scale in India and also in Karnataka. So yes, now there are vaccines. There's not just one vaccine. There's several vaccines available in the world. We know Indian manufactured Covaxin, and we know Indian manufactured, but the one which was uh, prepared by Oxford AstraZeneca, that is Covishield, that is there, and Sputnik from Russia is also allowed now in India, and Pfizer, Moderna, Johnson and Johnson, all these vaccines, Chinese vaccine, all these vaccines are now being used world over. But in India, very small proportion of the target population is vaccinated so far. We need to vaccinate at least 60 to 70% of the people with both the doses. Only then will be safe without a danger of beds not being available, ICU beds are not being available, oxygen supply, all such things. So with the for that, there is preparation that's happening in India from the government that it is also now trying to import, but still for the vast population of India, you you had to plan it in advance and also give orders to different companies. And there is criticism on government that government has not done it to the extent that is necessary. But there is another issue which is actually bothering scientists, that what if the virus changes its nature? And then even if a person takes vaccine, it does not give full protection. Well, there's so far the vaccines that are available are giving protection to all the variants that are there in circulation in the entire world. So as you know, the Indian variant is called Delta variant, and there's little more change in the genetic makeup of that variant, and it is also called Delta plus variant. So after the Chinese variant, it was the UK, South African variant, Brazil variant, and the Indian variant is called Delta variant. So these are the new names that were proposed, because earlier they were used to, people used to call them by the name of the country where it originated. So that also created a lot of problems, that people started stigmatizing the countries of origin. So that is actually ridiculous, and the WHO it started giving names like this. Well, WHO has played some role in understanding the nature of these viruses and how to contain all that, but still there is some criticism in WHO also, that it did not take stringent actions, or did not suggest measures to some governments who in fact were responsible for the spread, and they did not give much caution in advance. But well, these are the issues that have to be discussed and analyzed later. But as of now, it is WHO which is actually leading in giving the scientific information from one country to the whole world. And in places like UK, there are agencies. Like in India, we have ICMR. ICMR is actually a research institute, but the institutes which have to work on the epidemic and disease control, they should take lead and give proper instructions to the scientific community, and also to the government, and also to the population in general. So unless there is a very big change, very big mutation in coronavirus, we don't have to worry much if there is if vaccine is available for all the people. Well, the million-dollar question that what is the future and the imminent third wave, how will it behave and how will the population in India get affected is a serious question. But scientists have come up with some solutions that third wave is going to be there in India since significant population of our country is not still vaccinated, and it will start somewhere in August, September, and its peak will be somewhere in October, November. That's the prediction. That's a projection. And some people are worried that since there were reports that more children will be affected because of coronavirus. Well, that's true, but it is only in a relative sense that in first and second wave were also children were affected to the extent of 25%, and it may increase in third wave. That is because in the last few months and in the coming months, it is the adult population which will get the vaccine. So those who are below 18, there's no vaccine in India so far, but maybe by September we'll get some relief because teenagers will get a vaccine. It is not still tested and approved in the population, the younger population who are under 18. But in US, there are vaccines which are being given for the children in the age group 12 to 18. So this is the issue. That is why people are saying that children will be more affected. But it is not that the new variant will go behind only children. No, that is not the thing. When adults will be affected, probably adults will be more affected compared to children for two reasons. That the population above 18 is more, and secondly, even in first and second wave, though children were infected, they were not affected much. There was very less mortality in children. So we need not panic about it. At the same time, we need to take all the precautions, which is called COVID appropriate behavior, that is wearing mask, maintaining physical distance, and washing hands, and avoiding crowds. These are the precautions that we have to take. And vaccines. Well, yes, there are questions about vaccines, not just about the efficacy, but what's the use when you have already had natural infection and that the vaccines have not been tested fully. There are some questions, but I can only say that we are not living in an ideal condition. We are in a given condition wherein taking vaccine is much more beneficial, not just to the individual, but it helps the community at large by preventing spread, number one, and also preventing mutation to an extent. Because when there is not much spread, the chances of mutation is also less. So prioritizing vaccination for those who are vulnerable, like aged people, diabetics, obese people, and those who are actually at the post kidney transplantation, post chemotherapy, cancer patients, such people we need to prioritize them. And there are people who are vulnerable, like poor, marginalized communities. They'll have to be vaccinated first. So if we do that, then definitely third wave will not be as severe as second wave. But even a single death should be we should be concerned about it, because we know so much now about COVID vaccine. There is experience, ample evidence by the experience of different countries, and we should work towards as less mortality as possible, even in third wave. So that is, we have only limited options, and we need to explore those options to the maximum possible extent. So this is about corona
virus, vaccination, medicine, and what is the future of the pandemic. Well, this is in chat, and if it's an interactive session with questions and answers, then it would have been more beneficial. Anyway, thank you for providing me this opportunity.